My name is Oren Gottfried, and I'm a spine surgeon within the neurosurgery division. I tend to focus in on spinal deformities, spinal trauma, and spinal oncology or spinal tumors, but I also treat general degenerative spine disease as well. I generally prefer that all patients try pain management, medical management, meaning various different medications outside of narcotics. I recommend that every patient try at least 6 to 12 weeks of physical therapy. And I do recommend a trial of non-operative interventions such as steroid injections. In general, if someone has severe weakness or severe problems, they're not able to stand upright or severely debilitated, we don't have to go through all those measures. But if someone's really uncertain about surgery, it's very nice to try everything else, to check box every other option. And if that's not working, that's where we can have a very candid and serious conversation about surgery. It's very common that a patient says, so what would you recommend to your wife? What would you recommend to your mother? And it's very nice for me to admit to them that I've already thought about that. I've already thought about if my family member was going through this, or if I was going through this, what would I want? And that makes it very fair when I recommend surgery or I don't recommend surgery. I just don't want someone to go through unnecessary stress, unnecessary physical changes, and so I'm always thinking about those decisions. One of my hobbies is I write for TV, and I have several shows I write for, and I have varying roles from going on set and helping them make medical reality look real, to actually writing shows and writing episodes and working on pilots. I always emphasize when I've talked about this great hobby I have that medicine and the care of my patient comes first, but most people would want a doctor that's well-rounded, and here's my chance to tell everybody about it.